With 50 days until Election Day, Donald Trump is returning to North Carolina tomorrow. He will be at High Point University at noon and then travels to Kenansville to speak at 5 p.m.
Meanwhile, Hillary Clinton will be in the Northeast on Tuesday. She'll speak at an organizing rally at Temple University in Philadelphia. That's 2 months after accepting the Democratic nomination in July. And with election just around the corner, a lot of focus has been placed on the health of both major party presidential candidates. I took a look at why voters care. Last Sunday, this video emerged of Hillary Clinton stumbling into her car after feeling faint. We found out later she had pneumonia, a minor viral condition, but it seemed to spark a national conversation on the health of our presidential candidates.
When we think about our political leaders, we almost have an expectation that this person will be superhuman.
Dr. Franzese specializes in medical sociology and tells me this concern with candidate health isn't really surprising.
So if we are perceived as having a leader who's weak, a leader who's sick, that by proxy, that view will extend to how our country is perceived. So if we have a sick leader, we'll be perceived as a country that's not well, that's not strong.
University physician Dr. Archinal also isn't surprised, but argues that with Hillary and Trump, health, at least for now, is a non-issue.
I think we forget what the health of past presidents has been.
She points me to cases like Woodrow Wilson, who had a stroke, FDR, who had polio, and John F. Kennedy, who had Addison's disease.
Was he less effective as a president because he had Addison's disease? Absolutely not. Would it have counted against him in the voters' eyes? Quite probably, because people wouldn't understand what it was.
With Election Day drawing closer, Archinal tells me it's time to move on.
Unless somebody has a progressive cognitive issue or a potentially progressive cancer. Those are the two disqualifiers that, as a physician, I would see. Everything else makes no difference. We have good health care. They have better health care coverage than any of us.
But that's a story for another day. Perielia Durrani, Elon Local News. Clinton, Trump, Mike Pence, and Tim Kaine have all publicly released health records following Clinton's pneumonia diagnosis.